So we move on to the next session. You heard a keynote. We will continue to discuss the healthy living for a healthy society, where we focus on prevention. So please take your seats, and we will listen to two speakers. My name is Björn Arvidsson, and I will be the moderator of this session. And I would like to urge you all to listen carefully to the presentations and ask some questions, because we want to have a good dialogue with them. Otherwise, of course, I have questions, but I think it's better that you ask the questions. So please keep in mind and raise your hand after the presentation, and we'll try to make sure that we can have a dialogue. Okay, so we jump right into it. The first example that we will listen to is from Marius Geanta. He's the president and co-founder of the Center of Innovation in Medicine, Health Innovation Romania, and he will talk about 4P CAN, or Personalized Cancer Primary Prevention research through citizen participation and digitally enabled social innovation. So I give the floor to you. Give him a warm applause. Thanks.
Thank you. Thank you, and good morning. Very happy to be here today and to speak about the 4P CAN project that we, Center for Innovation Medicine, we are coordinating. The project is funded under Horizon Europe, part of the Cancer Mission Prevention and Early Detection portfolio. So 4P CAN stands for Personalized Cancer Primary Prevention Research through Citizen Participation and Digitally Enabled Social Innovation. This is the full title of our project. And from the beginning, I have to say that our project actually is trying to cover at least 7 out of the 13 recommendations of the Cancer Mission Board, starting with understanding cancer, but not from a biological perspective, but from an individual and social dimension, social perspective. And then is the idea to implement more efficient cancer prevention strategies and policies. I already mentioned the personalized approach. It's very important as well to look to the quality of life of high-risk individuals, to achieve health equity, and I will explain a bit in a few minutes about this, to accelerate innovation through living labs, and I will refer in details to the living labs, and to transform cancer culture, communication, and capacity building. And I think this is crucial when it comes to cancer primary prevention. What we are trying to do with the 4P CAN project is to complement the, I will call it, traditional top-down approach when it comes to cancer primary prevention with a bottom-up approach. So in our project, we'll try to look on different layers to what are the enablers of the adoption of the European Code Against Cancer, because the European Code Against Cancer is in the center of our project, and each of the recommendations. And our consortium consists of 11 partners. 6 of them are from Eastern Europe, 5 are from Western Europe, and I'm very happy to see here today with us IARC, who is a partner in the project, Allcan International, Eduardo is here, but also Ivo from Bulgarian Joint Cancer Network. So having this distribution of the partner, is clear that we are, I think, very well positioned from the perspective of addressing inequalities and taking into consideration what is specific at the local level in Eastern Europe, from a cultural perspective, from a societal perspective, from an individual perspective, in order to maximize the adoption of the code and the implementation of the recommendations. So the topic of cancer is complex, but is true also for our project. But I'll try to explain in the next slide what we are going to do in the next 4 years. So we'll look first for each of the risk factors and recommendation of the European Code Against Cancer. We will assess the legislative framework at the European, national, and local level. On the other side, we'll look on the economic behind the risk factors and the social factors related to each of the factors. when I'm speaking about social, I would like to say that we'll include here what came very prominent from the pandemic, the role of informational space, the role of disinformation, misinformation, fake news, and infodemia. And we had some early data before the pandemic on cancer prevention, on how important it is to assess the informational space and to find ways to have a more personalized communication to the citizens in order to deliver the right message to the right people at the right time. And the third layer in our project is to go at the individual level and to assess what is actually happening at the micro level. In other words, to try to assess what is around us immediately in our family and very close friends, and we'll use the personal network analysis in this regard in order to better define and understand our microenvironment, as well the meso level, who was really important, especially in the small cities and rural areas in the pandemic, and with the mayors, local authorities, maybe priests, very influential in let's say COVID-19 vaccination. And I think this is a way to go and to assess also for the cancer primary prevention. And the macro level I already explained, especially the informational space, but also regulation, legislation, economic, macroeconomic factors that might influence the cancer primary prevention. Usually, if we speak about the cancer primary prevention, we tend to exclude actually 60% of the health determinants from the discussion. And these 60% are individual factors and social factors. And our project is looking, and we are trying to better define and to understand what are these 60% usually neglected factors when it comes to cancer primary prevention. This is the structure of the project. I already mentioned that we will assess the cancer risk factor prevention in terms of legislation, the social, economic, informational determinants of cancer prevention. What is very important is that based on this assessment, we will then go and implement rounds of targeted personalized campaigns, and through the living labs, we will go at a very, very granular level. So we will start from European level with all this assessment from the first two work packages. Then we'll go to the national level. Then we'll go to the regional level and local level. And the living labs, one of the living labs will be in Romania, in a county in the center of Romania, and you can see the official announcement of the living lab at the community days in June this year. And yeah, I have been invited there to speak, and I have to say that this is a small community, like 3,000 inhabitants. It's a rural area with a lot of elderly people there, some vulnerable population, Roma population, and so on. So we choose this very hard to deal with environment to go with our project there and to start building what we think that will be a model for the cancer primary prevention. And we already started our work, and in September our group of social scientists already collected the first wave of data coming from the personal network analysis. And the aim of the personal network analysis is to try to understand how different opinions and perceptions and attitude are spread in our personal network. So this is, I think, is done for the first time in relation with cancer and with cancer primary prevention. And we are very much looking forward to see the analysis of the first data. And what will follow, we'll have beginning of next year, the second wave of data collection, and the third in the fall of the next year. But in between, We will start working with the community and with the citizens based on the insights coming from this analysis, and we'll build what I called earlier the personalized communication campaigns. And this Friday we'll have the first citizen engagement activity in this small community. I think it's for the first time when in a rural area in Europe, people will heard about cancer mission and primary prevention and how to innovate and so on. And what we are intending to do, because this personal network analysis is something new for the health and for the primary prevention, is to define the methodology by the end of this year in order then to go to the cities, to other regions, and so on. This is the frame of the personalized communication based on this micro, meso, and macro level, and was developed by our group in the context of the pandemic. And based on this on this matrix, we'll build very personalized communication campaign, and hopefully we will see the results of implementing this campaign once the second and third wave of data will be collected. And we are aiming, of course, to build a multi-network analysis with a very basic level of the citizen, and with an in-depth analysis of the stakeholders level, and there are some models that we are testing there. And the idea is to understand how actually the communities interact with the stakeholders and vice versa, and what are the most adequate methods actually to deliver a campaign or to implement a personalized primary prevention campaign for cancer in different environments. I will end by saying that in parallel, we are part of a project around HPV vaccination. It's under EU for Health, this project, but basically it's the same idea, to better define the target audience in order to implement in a more personalized way the HPV vaccination campaign. And what we identify from the very early data is that at the society level in Romania, we have like 4 groups: people who are in favor of the vaccination, against the vaccination, hesitant, and not interested. So it's very clear to understand that for each of the group, we should tailor and personalize the way we communicate. So thank you so much.
Thank you. So who in the audience wants the first question? Yeah, we have one over here. So please wait for the microphone. Please tell us who you are and then state your question.
Thank you very much. My name is Bettina Borisch from Geneva in Switzerland. Congratulations to tackle complex systems, because I think that's what we all missing out. We all do single issue advocacy and forget that everything happens in a complex system. So I'm much interested in how you will collect and analyze data in this complex system analysis.
Yeah, I think it's no other way to go than to consider complex system. But in reality, we should probably start, as you mentioned, with the traditional way of collecting data, in our case, coming from personal network analysis, then data coming from stakeholder mapping interaction and other type of data. So we'll collect, let's say, layer by layer, and we'll try to integrate this data in the frame of a complex system. This is the approach. We try to find the model, but yeah, are actually very few publications. And the one I presented is on obesity, is for, I think, 10 years ago. So there are no actually models to refer to. Yeah.
Okay, thank you. We have one more question before we change speaker. So Eskil, please.
My name is Eskil. I'm a vice chairman of the Swedish Brain Tumor Association, and thanks for a nice presentation. I saw a similar work in cancer, but that's not in cancer, but that's it's a commission report from Lancet. It's called "Bringing Death Back into Life," and they talk about in the really end of the life when we are dying about this network analysis, which I think is beautiful. So, congratulations on that. what I thought about who collects the data, because why I'm asking that is if you look to similar initiatives, but not from cancer and prevention, is a citizen science approach. So who is collecting the data, and how do you increase the quality of the data, and how do you reach out for people that are not willing to share data with researchers, society, and others?
It's a very good question. I'm afraid I'm not the right person to fully answer your question, because we have, as I mentioned, a group of experts in sociology who are actually experts in personal network analysis, and they have their own methodology, and we work a lot in order to be aligned with local requirements in terms of, you know, GDPR compliance and so on. Yes, and it's an issue, and we'll try with our citizen engagement activities to keep people interested in our research, and yeah, to be part of the second and third wave, because it's very important to have more or less the same group of people following a longitudinal manner. And on quality, that's why we put this this milestone to define the methodology in December, and this will require actually a discussion on how to improve the quality of data. And I think this is a process that will go in parallel with what we are doing in the project. Thank you.
The next speaker will be Helen, who's the Secretary General of Non-Smoking Generation from Sweden. So I give the floor to you. I know you're in a hurry, so we'll see if we can manage the questions afterwards. But you need to rush to an airplane, so please welcome.
Can you hear me? Nu kanske. Hör ni mig nu? Can you hear me? Thank you. Thank you for being here. Good morning, everyone. My name is Stjerna, and I work as the Secretary General for a non-profit organization called a Non-Smoking Generation. Since 1979, we've been working for a tobacco-free generation. And besides from spreading knowledge in Swedish schools, we also advocate for stronger health policies and the implementation of the World Health Organization's Framework Convention on Tobacco Control. Today, I would like to tell you a little bit about the Swedish legislation for a smoke-free generation and how that's been working. But I would also like to tell you about the tobacco industry tactics, how they have recently managed to circumvent all the Swedish legislation, and they keep on recruiting our children into a harmful nicotine addiction. I would like to start by looking back. In the late 70s, smoking was still a huge problem in the Swedish society. As a child, I was often very ill because of my father's heavy smoking in the car or even inside home. At the time, smoking was allowed almost everywhere in the Swedish society, and half of the Swedish male population were smoking on a daily basis. As you can see in this picture, the smoking rates have been decreasing steadily since the early 80s. And also I would like to say this is really due to all the tobacco control work that we have been doing since then. In 1989, we implemented a marketing ban for all tobacco products. In 1993, I think, we were the first in the whole world to implement smoke-free workplace. And a couple of years later, we also got the age limit for buying tobacco in 1997. 2005, we got smoke-free restaurants, maybe also first in the world, I don't know, but maybe. And since then, we halved the number of Swedish smokers in the adult population. And somewhere around here, in 2019, we also got smoke-free outdoor seatings as well. Along with the excise duty on tobacco, these tobacco control initiatives have brought us to the relatively low smoking prevalence that we have among adults today. Today, somewhere between 6 and 10% of the adult population are smoking on a daily basis. So it's pretty good, I would say. Since 2016, we have been conducting a yearly survey to monitor youth attitudes towards tobacco and also their knowledge about health risks and sustainability issues connected to tobacco. And as you can see in this question, we ask why anyone would like to start smoking. And in all 8 surveys since 2016, the peer pressure is the main reason. 9 out of 10 says that the influence of friends is the most important reason why anyone would like to start smoking. All forms of tobacco use are social habits, and this is also the main reason why it's so important with smoke-free environments. It's really important to prevent children from starting, but also to help smokers to quit. So, are we done then? Can we now lean back and look upon tobacco-related disease and mortality as something in the past? It would have been nice, but unfortunately not. First, we still have large differences. I think Ulrika mentioned this in the morning. Large differences between less educated people that smoke significantly more than those with high education. And secondly, and maybe more importantly, the tobacco industry is working hard to find new ways to reach our next generation nicotine-addicted customers. And that's why we need to keep on doing some more regulation work. In Sweden, the tobacco industry tactics is spelled tobacco-free white snus. And maybe you haven't heard of it. In Europe, it's called nicotine portions. In 2016, the Swedish tobacco industry launched the white snus, and by calling it tobacco-free, they could circumvent all the tobacco legislation that we've been working on since the early 80s. I think it's important to say that the nicotine in these products is extracted from the very same tobacco leaves as any other tobacco product. But this was a way to circumvent all our legislation. And since then, the history is repeating itself. And the tobacco industry is using the same lies and tactics today. This is from an Instagram post 2 weeks ago. And this is a tobacco commercial from 1950. And since then, the marketing ban for tobacco products, despite the marketing ban for tobacco products, this is what it's been looking like in social media. It's been flooded with influencer marketing, and these influencers are promoting the new tobacco products with candy-like flavors and glamorous design. Free samples were just 1 click away, or even handed out for free at different launch events and music festivals, or even outside schools. Not only did they circumvent the marketing ban, but they also managed to circumvent tobacco taxation by calling it tobacco-free. And this means these products, this can is at the same price as the cost of an ice cream. So it's really affordable for price-sensitive teenagers. and that's a big problem. The Swedish Council for Information on Alcohol and Other Drugs, they have been conducting a yearly survey in Swedish schools since 1971. And in their latest report, we can see that the use of new nicotine products among youth is increasing rapidly. 42% of the girls had used white snus, and 37% of those girls, they had never before tried to smoke or use any traditional kind of tobacco. So it's really important to say that they reach out to a completely new group of tobacco users. And since the launch of disposable e-cigarettes, do you know what disposable e-cigarettes are? Have anyone seen them? I can show you how they look. They look more like a pen or something, a toy. I thought I brought one. Yes, here. You can pass it on if you want to. I think if we have any parents here in the audience, it's important to recognize what they look like. Because since the launch of these so-called disposable e-cigarettes, the use is really exploding. If you can also Google puff bar, and you can see the many sorts and the many flavors, and it's all candy-like or fruit-like flavors. But since then, it's skyrocketing, and 48% of the students have now tried the e-cigarettes. All in all, 62% of the students have used any kind of tobacco. And this is compared to 30% when I started in 2015 when I took this job at Non-Smoking Generation. And it's not so many years, I would say. So it's quite alarming, I would say. In our yearly survey, we also ask why anyone would like to start trying these new products. And as you can see, the answers really reflects the tobacco tactics. It seems less dangerous, and it's got appealing flavors. So they know what they are doing. Many years of intense advocacy work finally resulted in a new law regulating the white snus and the tobacco-free nicotine portions, nicotine products. Marketing in TV and radio is no longer allowed, and that's good. But you can still market in social media, so that's not so good. All forms of sponsorship is prohibited, and marketing must be moderate. Advertising cannot be intrusive, encouraging, or encouraged to use. But still, this is what it looks like. They keep on market these products with appealing flavors, and I think it's a huge mistake to regulate different products differently in different laws. And at least the same rules should apply to all the platforms. So if you have a marketing ban applied on TV and radio, it should also apply to social media and outdoor commercials as well. And it's important to say that legislation alone cannot solve this huge problem. We need to work with knowledge spreading efforts as well, of course in schools, but also to the public. 95% of the students that we meet, they say that facts about health risks and effects on sustainable development motivates them to a tobacco-free life. So we should keep on spreading the facts. So to summarize, legislation for smoke-free environments, marketing ban, age limit, and tobacco taxation have all been effective measures to reduce smoking in the Swedish society. Going forward, we need to be aware about the tobacco industry's true intentions and to protect children from all sorts of nicotine products. We need a proactive legislation, I would say, that includes all the future products from the tobacco industry. And finally, I would like to inform you also about this European Citizens Initiative, where you can sign for a tobacco-free Europe and a tobacco-free generation. Thank you.
Thank you. So I guess we have time for one question. So who wants that question? We have one over there.
Hey. It is. It is, absolutely, because all the nicotine is extracted from tobacco. Yes, I know. It's terrible because, yeah, and that's the problem. We need to raise awareness that the nicotine is far from harmless. First of all, it may be not. It maybe not cause cancer, but still there's a lot of serious sicknesses that comes out of nicotine. And nicotine is a deadly poison, to be honest. And we see more and more suicide coming out of the nicotine. You know, you can use the nicotine liquid that's meant to be in e-cigarettes, and if you drink it, it's an easy way to commit suicide. So the problem is people don't know that nicotine is poisonous and that you really get sick. You get diabetes, you get heart and lung conditions, and it also affects the brain. So if you start with the nicotine, you can see that you're also at risk of starting to drink more alcohol and use other drugs. So if we want to keep our children drug-free, we should really start with the nicotine.
Perfect. Thank you very much again. A warm applause to you.
Thank you.
I know you have to rush off, and we need to rush to a coffee break, right? And everybody who has more questions for Marius, please grab him in the coffee break. Otherwise, we'll see each other back here 5 minutes past 11. So see you in 10 minutes then. Thank you.